Let's talk about the food category that creates the most confusion, the most fear, and the most conflicting advice in my clinic: dry fruits. If you have been diagnosed with stage 3 chronic kidney disease, or if you are seeing your creatinine creep up towards 1.4 or 1.5, you have likely been told to stop eating them entirely. You've been told they are potassium bombs. You've been told they are full of sugar. And if you eat the wrong ones in the wrong amounts, that advice is absolutely correct. A handful of dried apricots can spike your potassium to dangerous levels. But if you ban all dry fruits, you are missing out on 5 specific, potent tools that can actually help lower your creatinine load and protect your remaining kidney function. Today, we are going to operate with surgical precision. No vague advice like eat in moderation. I am going to give you the exact chemistry, the exact counts, and the specific preparation methods for the 5 dry fruits that belong in a renal diet. And we will talk about the ones you need to throw away immediately. Let's start with the absolute heavyweight champion for kidney inflammation: walnuts. Most seniors I treat for kidney issues also have some level of cardiovascular concern, high blood pressure or cholesterol. These two systems are tied together. If your blood vessels are inflamed, your kidneys, which are basically balls of blood vessels called glomeruli, are suffering. Walnuts are unique because they are the only tree nut with significant amounts of ALA omega-3 fatty acids. Think of ALA as a coolant for an overheating engine. When your kidneys are filtering blood 24/7, they generate heat and oxidative stress. The omega-3s in walnuts help reduce the inflammation in the tiny filtering units. But here's the mistake everyone makes. They eat them raw, right out of the bag, with the skin on. If you have sensitive digestion or are worried about phosphorus absorption, you need to activate them. This means soaking 2 whole walnuts in water overnight. Why? Because nature put a protective coating on nuts called phytic acid. Phytic acid binds to minerals and makes them hard to absorb, and it can irritate the gut lining. A leaky gut leaks toxins into the bloodstream, which your kidneys then have to refilter. By soaking the walnuts, you neutralize the phytic acid. Your prescription here is specific: 2 whole walnuts, soaked, eaten with breakfast. This gives you the anti-inflammatory benefit without overloading your phosphorus limit. Now let's move to the second powerhouse, and this one is specifically for those of you dealing with high urea levels or uremic toxins: dried apples. When your kidneys slow down, they stop filtering out urea effectively. This is what causes that metallic taste in your mouth or the ammonia smell on your breath. You need a binder, something that grabs those toxins in your gut before they get into your blood. Dried apples are one of the best sources of pectin. Pectin is a soluble fiber that acts like a sticky gel in your intestines. It binds to cholesterol and toxins and carries them out of your body through your stool, so your kidneys don't have to deal with them. But you have to be very careful with which product you buy. Most dried apples in the supermarket are bright white and soft. That is not natural. That means they've been treated with sulfur dioxide to keep them looking pretty. Sulfur can be an irritant. You want to look for organic, unsweetened dried apples. They will look beige or light brown. That is the color of natural oxidation. Portion control is critical because of the sugar concentration. I want you to stick to 4 rings a day. Chew them very well. This stimulates saliva, which helps digestion, and the pectin will get to work reducing that toxin load on your kidneys. Next, we need to address the controversy of raisins versus my preferred recommendation, dried cranberries or blueberries. Many people eat raisins for iron, but raisins are extremely high in potassium. A small box can have over 300 milligrams of potassium. If your potassium is trending over 5.0, raisins are off the table. Instead, I want you to switch to dried cranberries. But here's the challenge. Cranberries are naturally tart, so companies drown them in sugar. You must look for low-sugar or juice-sweetened dried cranberries. Why cranberries? Because the #1 threat to a senior with kidney disease is an infection. A urinary tract infection can cause acute kidney injury, dropping your GFR by 10 or 15 points overnight. Cranberries contain proanthocyanidins, specifically type A. These compounds prevent bacteria from sticking to the walls of your bladder and urinary tract. It's a protective shield. If you cannot find low-sugar cranberries, dried blueberries are your backup. They are packed with anthocyanins, which are antioxidants that protect the kidney structure from scarring. Your dose here is 1 tablespoon per day. Sprinkle it on oatmeal or eat it alone, but treat it like medication, not candy. Now let's talk about the mineral that controls your blood pressure found in our 4th item, almonds. High blood pressure is the 2nd leading cause of kidney failure. To relax your blood vessels, you need magnesium. Almonds are fantastic for this. However, many of you are terrified of almonds because of oxalates and kidney stones. Here's the science. The vast majority of oxalates in an almond are found in the brown skin. If you are prone to calcium oxalate stones, you should not eat raw almonds with the skin. You need to buy blanched almonds. These are almonds where the skin has been removed, leaving just the white nut. By eating blanched almonds, you get the magnesium and the vitamin E, but you drastically cut the oxalate load. The portion size is strictly 8 to 10 almonds. I know it's easy to eat a handful, but a handful is too much phosphorus. Count them out. 10 blanched almonds provide a safe level of magnesium to help keep your blood pressure diastolic number down, taking pressure off the kidney filters. Finally, let's discuss the most misunderstood nut, which is actually a seed, pistachios. We're seeing interesting data on pistachios regarding their ability to lower blood sugar and improve lipid profiles. Many seniors with kidney disease also have type 2 diabetes. Uncontrolled sugar destroys kidney filters faster than almost anything else. Pistachios are high in protein and fiber and have a very low glycemic index. This means they digest slowly and prevent blood sugar spikes. They are also rich in vitamin B6. B6 is crucial because it lowers homocysteine. High homocysteine levels are dangerous for kidney patients because they damage the lining of the arteries. But, and this is a massive but, you cannot buy the red-dyed or salt-encrusted pistachios. The salt content in roasted pistachios is dangerous for your blood pressure. You must buy raw, unsalted kernels or dry-roasted unsalted. The portion here is about 30 kernels, which is roughly 1 ounce. Because you usually have to shell them, it slows down your eating, allowing your brain to register fullness so you don't overeat. So let's summarize the do not eat list to be clear. Avoid dried apricots and dried bananas. They are simply too high in potassium for anyone with stage 3 or lower GFR, unless you were specifically told by your doctor to increase potassium. They are too risky. Avoid yogurt-coated anything. That yogurt coating is usually hydrogenated oil and sugar, pure inflammation. Avoid trail mixes with chocolate chips and